Let's be real. If you've ever opened your health insurance renewal and just felt that pit in your stomach, you are definitely not alone. It's this feeling of dread so many people and small business owners get every single year. So today, we are going to break down exactly why those numbers just keep going up.
To really put this in perspective, just look at this number. This year, some small businesses saw their health insurance premiums jump by a staggering 35%. I mean, that's not over 10 years. That's in one single year.
And this isn't just some abstract statistic. This is a real quote from a small business owner who's trying to deal with that exact number, a cost that just feels completely out of control, and it leaves you asking, what on earth is going on? Okay, so here's our game plan for figuring this out. We're going to start by looking closer at that shocking 35% hike. Then we'll unpack what's really a perfect storm of causes, and that includes a deep dive into what's been called the Obamacare paradox. After that, we'll get practical and talk about navigating your options. And finally, we'll look at the huge shift that happens when Medicare enters the picture.
Now, that 35% number, it's not just a fluke. While most people are seeing increases more in the 7 to 15% range, which is still a lot, these massive spikes are happening more and more, and they're really signaling a major stress point in the whole system.
Right, so this is the big question, isn't it? Why are these costs spiraling out of control? Well, it's not just one thing. It's actually a really complex mix of market forces, big policy changes, and just the realities of healthcare all crashing into each other at once. The folks who live and breathe this stuff, the insurance experts, they describe the situation as a perfect storm. It's this convergence of several powerful factors, and each one makes the others worse, creating these huge price increases that we're all feeling.
So what's feeding this perfect storm? Well, it's fueled by a few main things. First, there's a big lack of competition among insurance companies. Second, the cost of just going to the doctor or the hospital is going through the roof. Third, there are new rules about what every single plan has to cover. And finally, there's the overall health of the population. Let's dig into that first one, competition.
To really see this competition problem in action, just take Massachusetts as an example. Before the Affordable Care Act, the ACA, the state had over 200 insurance carriers you could choose from. After the ACA, that number was basically cut in half. And today, with more companies merging, there are even fewer. And we all know what happens then. Less competition almost always means higher prices for us. And that drop in competition, well, it leads us right to the Affordable Care Act, also known as Obamacare. This law completely changed the insurance landscape, and in the process, it created some results that nobody really expected. And this is the paradox. The whole goal of the ACA was to make health insurance more affordable and easier to get. But according to the professionals who deal with this every day, for a lot of people, it actually did the exact opposite. It led to less competition and a market that just keeps driving rates higher.
Okay, so this is really the heart of it. The law did something incredibly important. It said insurers can't deny you coverage because of a pre-existing condition. That is a massive win for millions of people. The trade-off, though, is that insurance companies can't really price for risk anymore. What that means is the huge costs for the sickest people now get spread across the entire pool, which, you guessed it, raises the price for everybody. And on top of that, the law said that all plans now have to include specific benefits, things like pediatric dental, and in some states, really expensive treatments like in vitro fertilization. They have to be in every single plan, whether you as an individual need them or not. And the price tags for these required coverages are just mind-blowing. A full round of IVF treatment can cost as much as $75,000. So when that coverage becomes mandatory, that potential cost gets baked right into everyone's premium.
And it's not just IVF. Think about cancer care. The average cost for the first 2 years after a stage 4 diagnosis can be up to $180,000. Now, that is life-saving care, but it's now a system-wide cost that insurers have to be ready to pay for, any customer at any time. Or take something like dialysis for kidney failure, which can cost up to $100,000 a year, every year. These are enormous, ongoing expenses that are now factored into the price of every single plan on the market.
So, when you put all these pieces together, you get this new reality. The whole financial model for insurance has changed. The cost of care for the sickest people among us is now being shared by everyone in the insurance pool, and that leads directly to higher premiums for the whole population.
Okay, so we've spent a lot of time on the why. Let's pivot to the how. What can you actually do if you're out there trying to find coverage, especially during those incredibly expensive years right before you turn 65?
This tricky period is often called the pre-Medicare gap.
It's that window of time, maybe from your late 50s to age 65, where you've left a job that gave you insurance, but you're not old enough for Medicare yet. For so many early retirees, this is the single biggest financial hurdle they have to plan for.
You basically have two main paths you can go down. First, you can go to your state's health exchange. This is your best bet if your income qualifies you for tax credits that'll lower your monthly payment. Or, if you don't qualify for those credits, you can work with an insurance broker. They're experts who can pull quotes from all the different companies and walk you through the whole process, and it usually doesn't cost you anything extra. And yeah, you gotta be ready for the sticker shock. For someone who's 62 years old, a basic, high-deductible plan might start around $500 a month. But a more comprehensive plan, one with better coverage, that could easily top $2,000 a month, and that's per person.
But then, the magic number, 65. When you turn 65, for most people, everything changes. Becoming eligible for Medicare isn't just a turning point for your healthcare, it's a massive turning point for your finances. And the difference in cost? It's just night and day. Someone in their early 60s might be paying an average of, say, $1,250 a month. But once they're on Medicare with a good supplemental plan, their all-in cost might be closer to $500. I mean, that is a huge relief for any retirement budget.
And this chart really drives the point home. It's not just about the cost right now, it's about stability. Medicare Part B premiums have gone up at a pretty stable, predictable 5% a year for the last 2 decades. Now compare that to the private market, where 7 to 15% increases are common. And those crazy rate shock spikes of 30% or more can just come out of nowhere and hit people so hard.
And all of this kind of brings us to a much bigger final question, doesn't it? We've talked about insurance rules and markets and competition, but if the real problem here is the ever-rising cost of medical care itself, driven, at least in part, by a population that's getting sicker, maybe the real solution isn't just about tweaking policies. Maybe the bigger question is, how do we become a healthier country? It's a thought that goes way beyond premiums, and it really gets to the heart of this whole thing.